Welcome to the Ottawa Hospital. Treating pain is an important part of the recovery process after your upcoming surgery. One of the options for pain control involves the use of specialized nerve blocks. This video will explain what to expect when having a nerve block for the leg or foot. Lower limb blocks are a group of techniques used to provide pain relief during and after surgery. The specific type of procedure, or block, varies according to the surgery, which may be on any part of the leg or foot. Local anesthetic, or freezing medication, may be injected into the groin, thigh, or ankle, depending on the surgery. This block can be followed by a general anesthetic, where you will be put to sleep for the surgery. These blocks can also be combined with spinal anesthesia, which involves an injection into the back to numb the lower half of the body, or with sedation using medication for relaxation throughout the surgery. About an hour before surgery, you will be taken to a special area where the block is performed. Here you will meet the team of anesthesiologists and their assistants involved in the procedure. They will explain the procedure and answer any questions you may have about the block. The decision to proceed with a block will be made at this time. Standard monitors such as a blood pressure cuff, heart rate, and oxygen monitors are used. An intravenous will be started, which will allow the anesthesiologist to give you medications if you need them. The position that you are in for the block will depend on the type of surgery that you are having. You may be lying on your back, side, or front. The area will be uncovered and wiped with an antiseptic solution to reduce the chance of infection. A small needle will be used to freeze the skin. The correct space will then be located and a single dose of medication is injected in the area around the nerves. For some surgeries, a small tube called a catheter is left in place to provide pain relief over the next few days. The procedure takes about 15 to 20 minutes and you will then be taken to the operating room for your surgery. You may receive some medication to help you relax. Most people tolerate the procedure very well. You may feel a pinch or burning sensation when the freezing medication is injected. You may feel discomfort, pins and needles, or muscle twitching while locating the correct space. If this happens, try to remain still and tell your anesthesiologist exactly what you are feeling. It usually takes more than 20 minutes for the freezing to take full effect. Your skin may feel warm at first and then be numb to touch. You may also feel weakness in part or all of your leg. The lower limb block is an excellent method of providing pain relief both during and after surgery. It freezes only the selected area where surgery is performed. Your pain should be significantly decreased immediately after surgery. This means that you are likely to require less pain medication, which lowers the risk of side effects like sedation, confusion, nausea, vomiting, constipation, and itchiness. Some lower limb blocks have also been shown to decrease the risk of developing chronic pain after surgery. People vary in how they interpret words and numbers. The following scale will give you an idea of the risks involved with this procedure. For example, a risk is considered very common if it happens to 1 in 10 people, or for example, to someone in your family. On the other hand, a risk is considered very rare if it happens to 1 in 100,000 people, or for example, to someone in a city. The lower limb block causes weakness of some of the leg muscles. As a result, you may be unsteady on your feet. Please ask your nurse for help when first getting out of bed in order to avoid having a fall. It is uncommon to get an infection at the site of the block. Rare complications include permanent nerve damage, serious bleeding, or a freezing medication overdose resulting in seizure or very rarely death. A single dose of freezing medication lasts for 12 to 24 hours. Be sure to fill the pain medication prescription ordered by your surgeon. As the freezing medication wears off, you will slowly become more aware of pain. It will be important to start taking pain medication pills as soon as this happens before the block has worn off completely. If the block is still working during the evening, we often recommend taking a dose of pain medication before you go to sleep. Occasionally, a catheter is left in place which provides continuous freezing medication and pain relief after surgery. This catheter usually stays in place for a couple of days. A member of the pain service will see you each day that you have the catheter to make sure that your pain is well controlled. The acute pain service is also available 24 hours a day, 7 days a week for any concerns about your pain management. Once the freezing medication is finished, the catheter is easily removed. You will receive more detailed instructions about your catheter if this applies to you. Please tell your surgeon if any numbness or weakness continues several days after the nerve block is performed or the catheter is removed. Please feel free to watch this video again and to ask any questions you have during your appointment in the preoperative assessment unit. Thank you for watching.